welcome everybody on this particular session of infertility. And as we all know, that as far as the infertility load in this particular country is concerned, 20 million people, that is 20 lakhs of people, require ART as a problem. And we all know that the male factor is present in nearly 50% of patients. And the government also says and given a guideline that offer examination to a male partner at the outset, as we do it for a female patients. And also it emphasizes that, all the sperm function should be also offered to the male partner, so to detect the problems to that particular extent. And infertility platform in every clinic should not lose any opportunity to screen younger patients for who have a problem these days of diabetes, hyperlipidemia, ischemia, renal failures, pituitary problems, and testicular cancer, which happen to be in early age. Now, the question is, till now, the blame was always given to the female, because she endured with everything. And now, when the finger is being pointed to the male partner, they get very worried about it. So, there is a whole lot of antioxidants are available in the market. And I'm sure the presentation today is just focused on that. What is the role of antioxidants in male and female infertility? And we all know that...
Recording in progress.
Just 1 minute. Antioxidants, the last word has not come. But every infertility specialists are using it left and right. And after Dr. Poonam has dwelled upon what all components are there, and as far as the antioxidants are concerned, she will do it, and think we will debate at that particular time. Dr. Poonam Goyal is an IVF expert, and she is the director of Panchsheel Hospital. And she has great academician, and she has written wonderful books which are very popular among the gynecologists across the country. And today she is going to do great justice. And you all know that she's the director of the IVF Center at Max Vaishali. And she's going to speak to you as a specialist on what is the role of antioxidants in male and female infertility, and what is her choice when it comes to her patient treatment. So over to you, Dr. Poonam. Good.
Thank you so much, ma'am. Thank you so much for your nice words. Let me share my screen. Beta, karo. Of antioxidants and nutrients, in fact, micronutrients in male and female infertility management. So now this slide is not moving. Yes.
Click on the slide.
Yes. So what is a micronutrient? Micronutrient is a chemical or an element which is required in trace amount for normal growth and development of living microorganisms. According to WHO, their impact on body's health is critical as they perform a range of functions. Deficiency can cause visible as well as hidden bad effects. So we can say these are important and critical for our well-being. So we should not underestimate the importance of micronutrients. While it may seem small, the ripple effects of small things is extraordinary, as quoted by Matt Bevin. Now, infertility affects an estimated 15% of couples globally, especially in developed countries, and 20 to 50% of the times there is male factor, as Madam just pointed out very rightly. Now, it has also been seen that with the time, the quality of the sperm or the quality of the male factor is decreasing. Like there is a study which was done in for the past 50 years, the sperm counts in Western countries appear to have declined by half in the past 50 years. And in India, there is a study for 37 years that also shows the same results. So what are the important parameters which we need to discuss? One is semen volume. It should be at least 1.5 ml. Total sperm in ejaculate should be at least 39 million. Sperms per ml should be 15 million. And the vitality should be, that means the live number of sperm should be 58% and progressive motility being 32% and total motility 40% and morphologically normal sperms should be 4% at least. Now, many a times the semen parameters look normal, but still there can be a damage to the DNA in the sperms and there can be DNA fragmentation, which is because of the reactive oxygen species. And in spite of this normal parameters of the semen, and patient may end up having no pregnancy. So we can say that apart from all the conventional causes of male infertility, a new and important cause has been identified as which is being responsible for the idiopathic male infertility. That is the presence of reactive oxygen species. The sperms are vulnerable to reactive oxygen species attack. Why so? Because the sperm membrane contains large amount of unsaturated fatty acids and there is lack of sufficient number of antioxidant system in their cytoplasm. The God has made our body such that the cytoplasm of the cells, they have their own micro antioxidant systems inside the cytoplasm, but it is not there when it is the case of sperm. And then what it leads to? It leads to damage of the sperm membrane and there is decrease in the sperm motility and ROS directly damages the sperm DNA. So here we can see again that there is direct injury to purines and pyrimidines. The strands of DNA, they break because of in excess of ROS and then they get cross-linked, which leads to chromosomal rearrangements as well and also to DNA damage. And so there is also increase in the males who are having increased DNA fragmentation. In those couples, there is increased risk of having recurrent abortions also. Then at the acrosomes level, the mitochondrial damage occurs and this mitochondrial damage will lead to less of the energy in the sperm, resulting in impaired motility, and there is break in the membrane, which also leads into impaired motility. So what is the oxidative stress cascade? 40 to 88% of non-selected, that means randomly taken infertile patients have high levels of seminal ROS. The normospermic infertile men have higher ROS levels and reduced total antioxidant capacity levels. ROS in semen originates from immature spermatozoa and the seminal leukocytes. So what happens? The lipid peroxidation occurs, which results in protein modification. As we just saw in the previous slide, there is rearrangement of the strands of these molecules, and this all leads to loss of sperm function. There is disruption in the sperm mitochondria. This all leads to oxidative stress. There is DNA, RNA damage, and as a result, there is poor reproductive outcome. So sperm DNA damage, the major molecular cause of male infertility, which has a negative effect on reproductive outcome in couples. Deficiency of the standard semen analysis in assessing the male gamete has led to an increased focus on sperm DNA fragmentation tests. You know what happens that we don't have this test routinely. We don't allow, that means, I mean the test is little more costly. It costs the patient around 5,500, and most of the clinicians, they don't recommend this test, and it is not taken up as a mandatory or baseline test by various guidelines which we follow while doing the infertility treatments. A plethora of evidence suggests that oxidative stress to be the primary causative factor for the post-testicular sperm DNA damage. Now, here you can see few sperms which are, this sperm is healthy, this is healthy, this is healthy. This is as seen on the fluorescent microscopy. Though routinely we don't do the fluorescent microscopy to see the DNA fragmentation, but still this is the picture. Here in this particular sperm, there is a broken halo which is a very large in size outside the sperm head. Whereas here this is compact and this is clean, this is not irregular like it is here. This is a good semen sample where you can see 6-7 normal sperms and only one is having DNA damage, which comes into the normal limit. But when you see this sample, which is shown in the B slide, here you can see almost all the sperms are having a bigger and broken halo outside the head of the sperm, and this is having a greater DNA damage. This is the method by which we do in labs. This is the staining method. This is done with right solution. This is done in propydium iodide solution. Here also you see the same. This particular sperm is not good. This is good. This is good. So like this, which have been shown by A, they are the good sperms, and which is shown by B, like there the particular halo is broken and it is irregular and it is large size, like you see here. Rest of the sperms are normal in these two slides. So sperm DNA fragmentation, the risk, it is a risk factor which are associated with this are varicocele, male accessory gland infection, endocrine abnormalities of the reproductive system, any chronic illness, then temporarily there can be DNA fragmentation, malignancy anywhere in the body, and advanced paternal age, environmental exposure to toxic drugs like toxic things like lead, and then lifestyle factors like smoking, like alcohol, like pan masala, etc. And it can be iatrogenic also when patient is on some kind of drugs like in malignancy. So here you can see this is these defects in the sperm, they are genetically determined, like mid-piece defect, the acrosome absence, double tail in the sperm. But these defects, like there is leak of cytoplasmic droplet from the sperm, and there is tapered shape of the sperm where acrosome is present and the tail is seen. These is caused by the elevated oxidative stress. Then if this kind of sample you use for ICSI, definitely there will be decrease in the fertilization rate and there will be low pregnancy rates. Now there is a new term coming which is called MOSI, that is male oxidative stress infertility. Terminology and clinical practice guidelines for this idiopathic male infertilities have now been proposed, and that is oxidative reduction potential can be a useful clinical biomarker for the classification of MOSI, as it takes into account the level of both oxidants and reductants, that those are antioxidants. So you have to take in account the levels of both oxidants and antioxidants. It is a novel descriptor for the infertile men with abnormal semen characteristics and oxidative stress, which includes many patients who were previously classified as having idiopathic male infertility, or the couple was having a report of everything normal and you were classifying the couple into unexplained infertility. Now the possible approach to avoid the DNA fragmentation and improve the reproductive outcomes, how we can do that. This is a sample. This is a sample where you can see lot of DNA fragmentation. So this can give you abnormal results in your, when you are doing the DNA fragmentation, then it will come out to be more than 35%. And otherwise also there will be no result in pregnancy when you are using these samples. The identification of underlying conditions are done and which are associated with DNA fragmentation. Like you have to rule out what is the cause of this DNA fragmentation. If any cause you can see, then you can avoid that cause. And if you cannot find any cause, then how to go about it? Then you have to treat, first you have treated the underlying condition, then you can give the hormonal therapy, and then you can move for eCME and other things to find the normal sperm and then do the eCME with the normal sperm. And you can use the antioxidant therapy with all these antioxidants like vitamin C, E, folic acid, selenium, zinc, carnitine, arginine, tyrosine, and these all antioxidant things we can use in these particular patients. So nutritional ingredients clinically studied in male infertility are lycopene, L-carnitine, L-arginine, coenzyme Q10, vitamin E, C, and vitamin B12, zinc, folic acid, then tribulus terrestris, and then selenium, then glutathione. These are the antioxidants which are considered to be good for in male infertility. Now coming on to few studies. Cochrane review was done in 2011. This was a pooled analysis of 34 RCTs where 2,876 couples were reviewed. There was a statistically significant increase in the pregnancy and live birth rate in the couples who had undergone treatment with antioxidants supplements. That review suggests that there are negative effects of elevated ROS on fertilization and that antioxidant therapy may be useful in treating the men with elevated levels of ROS. So in this study particularly, it was found that there was increase in the pregnancy rate and there was decrease in the DNA fragmentation after the use of antioxidants. This is another study where L-carnitine for asthenospermia and epididymal knob was used. Epididymal knob is that those are the cystic swellings in the region of the epididymis. That is because of the increased ROS. This total number of patients 35, age 25 to 39, treatment given 2 grams per day for 3 months. And straight away you can see the difference in these particular patients. There was improvement in the sperm count and motility and pregnancy rates as compared to the placebo. This is another study where L-carnitine in idiopathic asthenozoospermia was used. 100 patients were taken. The dose given was 3 grams for 4 months. And you can see the difference when it was not used and when it was used. So the number of ejaculated spermatozoa from 10.8, it increased to 142, and similarly motile sperms also increased. So L-carnitine increased the parameters drastically. Oral administration of L-carnitine improves the sperm quality in patients with idiopathic asthenozoospermia. Now coenzyme Q10 also increases the sperm motility. It was in the control group 19.1% and it came out to be 37.5 in the coenzyme group. And the fertilization rate improved from baseline 10 to 28.5 after 3 months of treatment. So coenzyme Q10 results in improvement in sperm function in cases of asthenospermic men. Then another trials for coenzyme Q10, here also the pregnancy rates improved and the sperm function improved by 70 and 60% cases, and sperm motility also improved in these cases. There was in better sperm motility index, better sperm. This is the when you are not using the drug. Now, lycopene in idiopathic oligosasthenospermic men. Here, 50 patients were taken from age 21 to 50 years. Oral lycopene was used. There was 70% increase in sperm concentration, 60% increase in sperm functional sperm concentration, 54% improvement in motility, and 46% in sperm motility index, and 38% in sperm morphology. So the improved levels in oligoasthenospermic infertile males was seen with the use of lycopene. Lycopene in idiopathic male infertility. This is another study wherein 50 Indian male idiopathic male infertility was there, and their lycopene was used 2000 microgram twice a day. Treatment duration obviously 3 months, that is the minimum required. Here there was 66% improvement in sperm concentration, 53% improved in motility, and sperm morphology improved by 46%. Lycopene therapy seems to have a role in management of idiopathic male subfertility. Then this is the another drug which we use in Ayurveda. This is ashwagandha, and it is also called as Indian ginseng, Withinia semnifera. It is an effective herbal remedy for the stress and infertility. Rather than providing restless energy as does ginseng, ashwagandha often causes relaxation. It improves blood circulation throughout the body and enhances sperm quality naturally. So it acts as antioxidative, anti-inflammatory, apoptotic, and anti-proliferative. So which is good for the sperm. Here you can see when you are using placebo, when you are using ashwagandha, the sperm concentration improved in placebo case from 10 to 13, but in this it improved from around 10 to 25. Similarly, sperm volume was better, sperm motility percentage index was better. Significantly greater improvement and regulation were observed in serum hormonal levels with the use of the ashwagandha treatment. Now coming on to zinc. Zinc deficiency is associated with decreased testosterone levels and decreased sperm count, and regulative role in progress of capacitation and acrosome reaction is important with the use of zinc. Low levels of zinc in seminal plasma of infertile males are reported. Meta-analysis of 20 studies of zinc supplementation in infertile couple suggested that there was significant increase in semen volume, motility, and betterment of sperm morphology. Then the use of L-arginine. It is a precursor in the synthesis of putrescine, spermidine, and spermine. These polyamines have important role as initiator in the spermatic motility processes. L-arginine alone or in combination with other micronutrients improve the motility of the spermatozoa. Spermatozoa from oligospermic patients with a very low arginine content are characterized by the presence of nuclear somatic histones and high damaged DNA content. Selenium reduces the oxidative stress as it is bound as a structural element in the sperm cell membrane in the form of the enzyme selenoprotein. Moreover, it optimizes the thyroid metabolism important for sperm production and has a positive influence on autoimmune process. Selenium intake improves sperm motility and morphology. Now, combination of micronutrients. Now, here comes the study where one mono treatment was given with any one of the things which we have studied, and then the combination preparation, that is multiple micronutrients. In group A, mono treatment was given, whereas the combination treatment was given in group B. 156 patients for mono treatment and 143 on multiple micronutrient. Combination treatment had a better result, almost to 15.2%, where with mono treatment the result betterment was 9.2%. Now, this was another study where they said that when we are doing the DNA fragmentation test, then only 3 hours abstinence is required. We don't need to have abstinence like we do in our routine semen analysis, where we give 3 to 5 days to the patient, because they say once the semen is there, then because of the increased ROS, naturally also there is some increase in the DNA fragmentation. So in these particular patients, only 3 to 5 hours abstinence is okay before you test. Utility of antioxidant in the treatment of male infertility. Clinical guidelines based on a systemic review and analysis of evidence. Here 97 articles were studied, and out of 97 articles they found that 70 articles were of low quality, and high quality, like 70 articles you can say there must be retrospective studies and all, and these 20 would be prospective studies. Here so let us see only what happened in high quality studies. 20 studies they saw there was 65% improvement, and then in the this was in the semen parameters. This was a sperm function. Sperm function also improved in 58% patients, and this is also this was in overall number of patients. Then in varicocele patients, they saw there were only 2 studies in varicocele, so it turned out to be not very significant. Abnormal semen quality, high quality studies were only 4, but still they saw 50% improvement and 60% improvement. So you can say antioxidant supplementations improve semen parameters. In addition, it provides the indications for antioxidant treatment in specific clinical conditions. So according to review of literature, this has definitely been proved that the use of these drugs or multiple micronutrients, antioxidants, they definitely improve the semen parameters. But what to be used and in which dose to be used and which preparation to be used, that is still not very clear. The advantages of antioxidant therapy, we have all discussed now. Motility improves, morphology improves, count improves, lipid peroxidation decreases. This is oxidative DNA. This also decreases, and DNA damage also decreases. So definitely there will be more chances of getting pregnancy. To summarize, in male infertility, the causes of male infertility are diverse. A large proportion of cases remain unexplained. Oxidative stress has been established as a significant mediator in many known causes and risk factors of male infertility. ROS-related injury reduces fertilization potential and adversely affect the sperm DNA integrity. The use of antioxidants to reduce oxidative stress across a range of etiologies and risk factors of male infertility has gained increasing attention. Number of studies have indicated that it is a feasible treatment approach and option for reducing the oxidative stress in the male infertility cases. Now coming on to female infertility. The American Society of Reproductive Medicine delineates infertility as the failure to conceive after 1 or more years of attempts of natural fertilization. WHO says that up to 80 million women worldwide having been affected by this, and prevalence of 50% of all women in developing countries. Causes of infertility: there can be ovulatory dysfunction, that is like premature ovarian failure, hypogonadotropic hypogonadism, PCOS, prolactin disorders, thyroid disorders, then endometrial and uterine abnormalities, and in the male factor we already have discussed everything. Now coming on to diagnosis. Whenever you have an infertile female or an infertile couple, after doing the male investigations or with side by side, you go for seeing the ovulation, then you see the tubal factor, then we see the then we see the male factor also, and sometimes after the normal evaluation we say these patients
कोई बात नहीं, घबराओ नहीं, लेकिन एक ही दिन लेना होता है और मैंने एक ही लिखा था.
Everybody mute themselves, please.
ना एक ही दिन लो, अगर आपने एक दिन और ले लिया कोई नुकसान नहीं करेगा.
Dr. Meenakshi,
mute
karo.
So in these patients where your evaluation everything comes out to be normal, we call them unexplained infertility. So in cases of unexplained or idiopathic infertility, necessary tests for unexplained infertility are done: semen analysis, assessment of ovulation, etc., assessment of tubal patency, endometrial biopsy, ovarian reserve you have seen, and serum prolactin levels you have seen. But after that, when you have seen everything. What do you think? You think of that there may be oxidative stress in these particular patients. The endogenous sources of oxidative stress are oocytes, follicular fluid, cumulus mast cell, inflammation, aging, and excessive exercise is also one of the causes. And then exogenous sources can be toxins, radiations, heavy metals, drugs, smoking, alcohol, and other pollutants also. So the pathological role, there is definitely a pathological role of oxidative stress in female infertility also. Now, the defense against oxidative stress. The female reproductive microenvironment is protected from oxidative stress through an interacting network of endogenous and exogenous antioxidant defense systems. Endogenous antioxidant enzyme directly facilitate the neutralization of free radicals. Endogenous antioxidant defense systems are incomplete without the exogenous natural antioxidant compounds which act interactively or synergistically to boost the endogenous antioxidant system. However, it can be difficult to consume a healthy diet even in countries with easier access to fresh nutritious foods. Restoring micronutrient levels to recommended levels in women who are having fertility problems could beneficially affect the mechanism of the fertility. The oral carnitine supplementation reduces body weight and insulin resistance in women with PCOS. There was a study where 60 patients were taken who were overweight with PCOS with BMI of more than 30. Treatment given was L-carnitine, metformin it is not, or metformin and both were given, and 12 weeks of L-carnitine. What they found that in one was placebo group and one was this group. Here you found there was a betterment in the fasting blood glucose levels, serum insulin levels, HOMA-IR levels, DHEAS levels, weight decrease was also there, BMI improved, waist circumference and hip circumference ratio also improved. So L-arginine in women undergoing ART, 120 patients of less than 40 years age planning for egg retrieval and embryo transfer. The treatment given was, one was 2000 named as AS 2000 group, AS 1000 group, and one was control group. This was that we have given 2000 L-arginine in these particular patients. The cumulative HCG positive rate was 52% in this, and as compared to the global pregnancy, clinical pregnancy rate, it was little better than that. And when we were using 1000, then you can see the results were far more better. And in control group, definitely the results were less. So in case of male infertility, in case of female infertility, both the HCG positive rate and clinical pregnancy rate showed a significant increase when we are using L-arginine. This is also same. Endometrial growth and uterine blood flow, a pilot study for improving endometrial thickness in the patient with a thin endometrium. L-arginine supplementation in patients with thin endometrium and high radial artery resistance index. L-arginine, 9 patients and 10 patients not given any medications, and there was improvement in, out of 9 patients, there was pregnancy in 67% of patients and in only 1 in control group. CoQ10 in women undergoing ART. The systemic review and meta-analysis, which was done in 2020 October, you can say the clinical pregnancy rate was improved with the use of CoQ10, 28.8% and 14% improvement when we are using placebo. Maybe the placebo also works sometimes because it reduces the stress of the patient that she is doing something. Oral supplementation of CoQ10 may increase clinical pregnancy rate in women with infertility who are undergoing ART procedures. CoQ in women of 30s. Low CoQ10 level is commonly observed in women who are having age in late 30s. This leads to age-related decline in fertility and increased rate of embryo aneuploidy. In the clinical setting, CoQ10 supplementation provides better response to ovulation induction and decreases odds of fetal aneuploidy in patients who are having age of more than 35 years. Vitamin D supplementation, vitamin D is also very important. Its deficiency is seen most commonly in the infertile group, and 67 to 85% of the PCOS group also you will find the vitamin D levels are less. In infertile women with PCOS and insulin resistance who are undergoing IVF, there is always an improvement in clinical pregnancy rate, and good quality embryos are formed when we use vitamin D3. There is improvement in the estradiol and progesterone hormone levels. All women undergoing IVF and ICSI and having a vitamin D deficiency or insufficiency should always be supplemented with vitamin D. The desired levels of vitamin D should at least be 30 nanogram per ml. Vitamin D deficiency should be considered as an important thing in fertility treatment. Now, some important findings. L-arginine contributes to angiogenesis and achievement of an optimum endometrial size for implantation, as has been reported in 2009. Higher serum concentrations of folic acid and B12 before ERT have been associated with higher live birth rate in folate fortification. In 2015 study, vitamin D and CoQ10 to clomiphene citrate resistant PCOS patient resulted in improving hormonal profile and oxidative stress. A nutritional supplement for improving fertility in women, a pilot study was done in 30 patients. Group A, 15 patients, group B, placebo, 15 patient. Duration of study was 5 months, age 24 to 46 years. We were using multiple micronutrients in these patients. In the group A showed 33% pregnancy, and group with the placebo showed 0% pregnancies. So prospective randomized trial of multiple micronutrient in subfertile women undergoing ovulation induction. Here you can see the effect was when you were using only folic acid, 25% patients were having ovulation, and it improved to 60% with the use of multiple micronutrients. Now, antioxidants in female infertility, there was another study. 50 trials were taken into consideration involving 6,510 women compared with placebo or no treatment standards. Oxidant treatment may be associated with increased live birth rate, and then among subfertile women with an expected live birth rate of 20%, the rate among women using antioxidants would be between 26 to 43%. Increased clinical pregnancy rate was also observed. Very low quality evidence though this is, but still it shows that an antioxidant may improve the benefits for subfertile women. To conclude, infertility influences females more or less around the world and bring with it considerable psychological sufferings to the couple. Oxidative stress influences the oocyte embryo quality and thus the fertilization rate. And I would say even the endometrium
Recording
and
stopped.
its quality also. The oxidative stress is reported to affect both natural and assisted fertility. Antioxidant strategies should be able to intercept both extracellular as well as intracellular ROS, restoring micronutrient levels to recommended levels in the women who are having fertility problems could beneficially affect the mechanism involved in the fertility. Now, this is a sachet which is used for females. This is named Carnisure LQ sachet. It has L-carnitine, CoQ10, lycopene, folic acid, L-arginine, vitamin D3 as well. There is zinc, there is cyanocobalamin, there is selenium. The most important 4 things which are very powerful antioxidants are L-carnitine, L-arginine, lycopene, CoQ10. So this is its use in idiopathic female infertility is recommended. 1 to 2 sachet can be given per day. This is Carnisure XT. This is used in male infertility. Here, L-carnitine, CoQ, then lycopene, folic acid, arginine, vitamin D3, and ashwagandha is there. Here also the same 4 antioxidants are there. but the formulation is little different for the rest of the things, considering that it is to be given to a male or given to a female. Now, few sperm and egg talks, you won't believe what I came through to be here today. If you keep these two happy, obviously you will be happy and your patient will be happy. Thank you.
Thank you, Dr. Hi. Thank you very much. I think, Dr. Goyal has been a good salesman. Both, to sell antioxidants, both for male infertility and female infertility. And she definitely said, if you use the combination of the antioxidants, that probably works better. And she also showed you large data from the our Cochrane review, both for the male and female infertility is there. But today, before I make a comment, we have a lot of infertility experts with us. We start Dr. Jyoti Bhasker, Dr. Rupam, Ila, Dr. Jyoti Agarwal, Aruna Saxena, Raj Bokaria, Dr. Deepti Nabh, and Meenakshi Sharma here. We will definitely like you to make a fair, honest comment about things. In the light which Dr. Poonam has said, the only thing what she had highlighted was an oxidative stress. There are not many tests available. The standardization is not there, but I think in a very future time, it will be definitely there. As far as the sperm DNA function test is concerned, there are many tests available. And I will say, Dr. Poonam said that not in all cases we require a fluorescent microscope. It is a very simple test, and this can be done by every infertility clinic because now we've been using it for a very long time, almost 6 years. And I find, when the DNA fragmentation test is more than 30, which shows, there's a poor fertility potential, you definitely can correlate it with IUI failure. You can correlate it with a couple of IVF ICSI failure also. Because the ICSI results are also in these patients are definitely lesser than the other patients who have had a ICSI. But I will like each one of you experts to make comments and speak your mind, what you think about it. Dr. Jyoti Bhasker.
Good afternoon, Madam and Dr. Poonam. Congratulations. You've done a very exhaustive topic. I think it must not have been very easy to prepare and to speak so much in details with so many of the data that you did present. As far as antioxidants are concerned, the market is flooded. We have got too many of them with multi-combinations. We really don't know which we need to use because, as you said, when you were reading out single trials, you need so much of this much, so much of all of these, and they have found results. In a multi-combination, every dose is not the required dose or the recommended doses. The doses tend to come down in that particular one. Rightly, as you said, that we really don't know which one to use, which not to use, what it should have, what it should not have. But only thing that is substantiated, I feel, is that vitamin D definitely has to be utilized in these particular patients. Vitamin E also has got a significant role to play, and that is where we can be giving it. But one thing that I would really like to ask you that in unexplained infertility for male, should we give antioxidants to all the patients or should we first do a sperm DNA fragmentation and only the ones which have a DFI more than 30 should be given an antioxidant, or in all patients do we need to really start?
I feel, Dr. Jyoti, all unexplained infertility patients, we should have at least DNA fragmentation. Okay. As you have rightly pointed out, the dose is not decided. Dose is not decided for all these antioxidants. We know one thing, we need to do give antioxidants. It will definitely do some benefits, especially in patients who are having unexplained infertility. But the problem is what should be the dose, and should it be given for 2 months, 3 months? Suppose in males, we have to give it for 3 months, maybe for 3 months, for 6 months, and then proceed for our next step. Like if we are planning in unexplained infertility, we are planning, suppose she is having good number of eggs and we are not in a rush to do IVF, and suppose we give her this multiple micronutrients and see the effect of those multiple micronutrients, we don't even have the know the time, that how much time should we wait for the results. I personally became too much interested in these. I had 2 patients. One of my brother's bahu, she was, the couple was having unexplained infertility. The male factor, they did not had this DNA fragmentation test. They did not have, and when the test was done, it was done in, they stay in Gurgaon. The test was done in Gurgaon, somewhere in the laboratory, and then that test came out to be 5% DNA fragmentation. I said, this is not the lab. It cannot be. I don't believe that report. Then I sent them to some IVF center, and there the test was done. DNA fragmentation came out to be 38%. And they were supposed to come to me for IVF here in Max. Then all those COVID things happened. Then I told her, both of them, I gave multiple micronutrients and told them to wait for 6 months. 6 months baad karenge, and they become pregnant naturally. And same thing happened with one more patient. They were also related to in my family. They were to come from Chandigarh for this IVF, and they also got spontaneous pregnancy. And one thing,
Dr. Poonam, COVID did the job, or the micronutrients?
मैं भी वही कहने वाली थी. मतलब ये भी कुछ patients became stress free also, or maybe this your antioxidant worked or not. I don't know.
No defined test. There is no defined.
I think, on the question, I will just go a little further with Dr. Poonam has said. When a patient is all right, then the woman requires only folic acid, and the gentleman does not require except a good diet and exercise and little bit lower stress for themselves. But as she said, in case if you have unexplained infertility, if you have IUI failure, if they have an IVF failure earlier, then in that particular case, it requires a marriage, I think. And in a male, when it is started, the LICO Q should be not 10, it should be 100, and people have started talking even 300 also in such patients. And once you get it started, they must continue till the woman is pregnant. This is what the saying is. As far as the female is concerned, madam has been able to say to it. Again, these are the cases of unexplained infertility that, you're trying to supplement. These are definitely, it goes without saying, they're very costly, and one has to see to it, depending upon, what kind of patients you have, then you need to use them. So this is what it is.
Can I
yes, doctor, yes.
Ma'am, when we see a lot of prescriptions from gynecologists that the first time the patient comes for them for an infertility evaluation, so all of them then to start with folic acid, and they will start off with one of these particular antioxidants. So we should not be promoting using antioxidants, as you said, in patients who come to us for the very first time, unless and until we have evaluated and we found that she's unexplained infertility, or probably her AMH is low, she's a poor ovarian reserve, or some other factors. So we should try and say this practice of just starting it off for every patient should not be well promoted. And
Ma'am, you are muted.
It is very important, and we should not rush all patients of infertility. If there is unexplained infertility, if there's an idiopathic infertility, if you find especially the DNA fragmentation is bad, even if your DNA fragmentation is more than 30, you can take it from me, however you may flood it. कम हो जाएगा थोड़ा बहुत, इतना कम नहीं होगा कि प्रॉब्लम हो जाएगी. And very rightly, madam has said, they require a frequent ejaculations, and during the day of the ART also, they said that the second specimen probably works better. And we all must all know it, that while in testes, if the sperm is there, there is no DNA fragmentation. Once it leaves the testes and goes in the tract, the fragmentation starts there. And that is why I say, even in spite of the repeated failure in high DNA fragmentation test, you should take a testicular sperm and use it for ICSI. So I think that is deviating from the antioxidant topic. We have many experts here, so they must make comments. What is their free opinion about? Dr. Jyoti Bhasker, you have never made what is your final answer?
Madam, I do not very easily give unless and until it's strongly indicated, whereas it's an unexplained infertility or a woman has got a poor ovarian reserve. It is only in these places, and preferably I use vitamin D, vitamin E, and vitamin C separately. I rarely use the combinations.
Dr. Meenakshi, will you like to comment?
Yes, ma'am. Antioxidants is very rightly highlighted by Dr. Jyoti Bhasker, ma'am, and Dr. Poonam Goyal, ma'am, that antioxidants do have a role in infertility. But if we go by the recent Cochrane analysis in 2019 in male and 2020 in female, both the studies, they have included almost more than 60 RCTs. And they have found around 7 to 10 RCTs who had some benefit of giving the antioxidants. But those studies, they have labeled it as a low quality evidence. And still, they require a large RCTs to be carried out to further establish the treatment in this antioxidants and subfertility, both in the male as well as female.
What is your guidelines for yourself? What is your guidelines for yourself?
Ma'am, I will be using antioxidants only for the poor ovarian reserve and in patients with unexplained infertility only, not routinely, to all patients.
I can see Dr. Ila Gupta here. Dr. Ila Gupta?
Yes, ma'am. Thank you so much. It was a wonderful presentation by Poonam, and Dr. Jyoti very rightly commented, and there are a lot of pearls of wisdom given by ma'am. And I also agree with this, that sometimes they are very effective, and specifically in male infertility, and as already said, that in the cases of idiopathic infertility, unexplained infertility and poor ovarian reserves, and sometimes in PCOD also, if we give extra micronutrients along with the other treatment, then it really helps sometimes. And I also saw a few patients who were waiting for IVF for there was male factor, and when meanwhile they were given some antioxidants and they conceived meanwhile. So there are things, but of course, as told by ma'am, that without DNA fragmentation, it should not be used routinely unless there is you feel that there is a need for it. And even I have seen in some patients with the blighted ovum, recurrent blighted ovum, when we give vitamin E and vitamin C and zinc, etc., there is also good results. So because there are no studies on this which can prove that it is so, but my practical experience that giving in these patients many times it helps, and they get a proper embryo, and it is that's why it is good to use micronutrient. But you should take care of these things, that it is very expensive drug, and you should not give as randomly to each and every patient, and we should see the pocket of the patient, unnecessary not to be given. And you should see the constitution of the micronutrients, that what are there in this. Unnecessarily extraordinary doses of these micronutrients should not be given, but appropriate and optimum dosage should be used in whichever combination you feel like using. Thank you, ma'am.